Hello, this is Dr. Kevin Christie, and today I'm going to go over how the low back and the pelvis work in the golf swing and what you can do at home to try to get better at the mobility aspects of this, which will help with your golf swing and help prevent and manage some of the low back pelvic conditions we see in golfers. And so there's really three things I'm going to cover today, and one is pelvic anterior and posterior pelvic tilting. We're also going to talk about pelvic rotation and then torso rotation as well. I'm going to show you how to test for it and see if you can do it, and then the actual correctives for it, which a lot of times look like the actual test. So the first one I'm going to do from the side is the pelvic tilting. So I'm going to get into my golf stance here. Then I'm going to anterior pelvic tilt. So you see the arch in my low back. That's going to be an anterior pelvic tilt. Then I'm going to posterior pelvic tilt under, just like that, okay? And see how that motion is. You can kind of subtly see I have what we call a little bit of a shake and bake, where on the posterior pelvic tilt I kind of shake a little bit. My low back muscles are kind of tight, something that I try to work on. During the golf swing, there's been a lot of 3D analysis showing that the pelvis will rotate during the downswing, but it also posterior pelvic tilts because of a lot of the abdominal crunch going through that. So you want to make sure you can do that motion properly. And so that first test there to really work on it, if you have problems with it in the standing position doing a pelvic tilt, so this is a golf swing pelvic tilt, and that could be difficult for you. So if it is, you would actually do it laying on the ground on your back with your knees up. And that's a much easier way of doing some pelvic tilting. And so that's definitely a corrective for you. So you want to make sure you're working on that. You can use a mirror at home to test yourself, okay? The second one is pelvic rotation. Can I get in the golf swing here and rotate just my pelvis without my shoulders moving, right? So you want to keep these shoulders still and you want to rotate and rotate. So can you separate your pelvis from your torso, which is kind of that X factor we talk about in the golf swing, and you need to be able to do that. And so if you can't, or you struggle with it, or even if you're just trying to be proactive, a great exercise is to really hold that there and to just start doing those rotations. Really try to focus on rotation. You don't want to get that side to side. So a lot of people, when they do it in the mirror, they'll get that side to side. So you really want rotation. Okay, so that's the second one. That's the test, and that's the corrective for it, or one of them. Most of these have many correctives. Okay, the third one is we're going to do torso rotation. Now, can you keep your pelvis still and rotate your torso? And if you can, how much can you get? Okay, we'd like to get about 45 degrees or more. Because obviously, when we have a backswing, they talk about 90 degrees, and a lot of that's say 45 degrees or so of the pelvis, and then another 45 of the torso. So when you're holding the pelvis fixed, can you get 45 degrees of it? Okay. If you can't, again, try to work on that. Keep that pelvis. If you have your shirt tucked in, you have a belt buckle, you can actually use that as your monitor. And again, the mirror will help. So from there, you want to see if you can just separate the torso from the pelvis. Okay, so those are three things to test and to work on. A lot of times in our clinic, we have people that are dealing with low back pain, so we treat them first with a lot of muscle work and a lot of these rehab exercises to get to that point where you can do these pain-free. If you're having a low back pain condition, you really want to make sure you get that taken care of first before you dive into, say, some fitness or testing movement patterns. Because if you're having low back pain and a condition with it, you're going to fail that test most likely. So it's kind of a false positive. So you really want to try to get that corrected first and get treated. And so that's where we see a lot of injured golfers in our practice, to try to get to the point where they can then do the correctives and obviously play pain-free and with high performance. So those are three pelvic low back tests to do. I challenge you to do it and find the correctives. If you're having pain, make sure you get someone to check that out for you. Have a great day.